So it's my distinct pleasure to be able to talk with Dr. Joe Millard. Dr. Millard is a veterinarian in Atlanta, Georgia, and she has a Shiba Inu that is 15 years old. And she's going to tell us a bit about his story and why she started using Cognicaps on him and how he's responded. Dr. Millard,
Okay.
it's a pleasure to talk with you today.
Thank you.
And tell us about Laddie.
So Laddie is a lovely Shiba Inu that acts more like a cat than a dog. So he spends most of his time sleeping and curled up in sunshine. So he's just kind of a quiet guy. So he spends most of his life being pretty quiet and mellow. And he's had no real major health issues in his whole life, except when I acquired him at 3, he did have a partial motor seizure disorder that was very intermittent, and he was on some anti-seizure medication that corrected it completely and was on it for many years until it actually caused some problems with his kidney function. So we took him off the potassium bromide, and he's been off the bromides probably for at least the last 5 years or so, and he was doing perfectly fine. So no health issues, doing great, just being his normal weird self, quirky self. But I went through a lot of changes, life changes, I guess, in the last year or so. And I noticed that, and he is now getting older too. And I noticed that when my mental state deteriorated to a degree, his did also. And so I just kind of knew that he was getting older, and I just kind of, he'd get a little forgetful. He just seemed kind of lost occasionally. And I just kind of attributed to, you're older and you're having a bad day or something. But I noticed there was one day when I noticed he was just literally staring at the darkest wall in the corner of the bathroom. And he spent the entire day staring at the wall. I'm like, this is not good.
Yeah.
And then shortly after that, I found him, he's a 30-pound dog, and I found him curled up in a covered cat litter pan, hiding, not trying to eat the litter. I'm used to them, doing that, but he was curled up, hiding, facing the backside of the litter pan. And I'm like, no, where he's hiding in little corners and not interacting, and he's just staring at the wall. I'm like, we're not doing this. This is not a quality of life for you. And yeah, we're not going to put up with this. And so Dr. Dewey was actually having a lecture or a Zoom meeting, some CE with, and he mentioned the Cognicaps. And so I trust him, and I'm like, and I like new ideas. I'm not a real fond person for a lot of Western medicine. Straight Western medicine. So the only thing I really changed in his whole diet and life and everything was to start doing the Cognicaps. And within a couple weeks, I noticed a tremendous change. I mean, he's no longer staring at the walls. He doesn't, the only time he climbed into the cat pen, he did do that once when I just moved, but that was because I used a clicker and I think he got really scared or something. I don't know, whatever. Anyway, he's back to his normal self. He's actually doing zoomies. He runs through the apartment now. And it's just, he's like better than his old self. Wow. And the only thing I can attribute it to is the Cognicaps, because I haven't really changed anything else in his diet or exercise or anything. So.
Wow. That is so wonderful. I have to tell you that it makes my heart, feel good, because that's really what we're about. We're trying to help animals. So when I hear stories like yours, it's an amazing feeling. So how would you have labeled Laddie? Do you think he was severe or moderate, or did you do a survey? Yes. We have a survey on our website.
Yeah, I didn't do the survey, but I would say, just from I do in-home euthanasia. So I see a lot of older dogs with cognitive dysfunction. That's why I'm there, is that their cognitive dysfunction has now gotten so bad that the owners can't sleep. They can't stop pacing. They just are not themselves. So I would say he was, in general, very mild to moderate, but then when I think there is a bond between us, I do think they feed into our energy. And so when my mental energy got bad, his really tanked. It was significant. Mm-hmm. And so then he did get severe. That was severe. I mean, that period of time, he was not functioning. He was literally spending his entire day staring at the wall. And that made me very nervous, or not nervous, but just, this isn't right. You know, we got to do something about this.
Yeah, I think you're right, though. I think they do feed off of our stress.
Mhm.
And yeah, so if they notice things aren't right in our world, it definitely affects them. There's no question.
And at least him in particular, I mean, he and I have been through a lot. And so he does feed, I've seen it now that he really does change with my behavior changes too. So, but yeah, no, he's doing so much better. Just night and day. And I'm in full disclosure, I don't even give him the full dose. I only give him 1 capsule a day, not 2. So
that's awesome. You know, dosing is it's difficult because it's hard to figure out. Every dog is different. And that's what we always tell people is you've got to find the right dose. For some it's higher, for some it's lower, for some it's the dose we recommend. But yeah.
I'm always an advocate of less is better if you can, you know, whatever. The lowest effective dose.
Exactly. Lowest effective dose is what we all want. So that's wonderful to hear. And we will definitely note that the dose that's working, because that kind of feedback is really important to us. Joe, what else would you want to tell people out there who have dogs that are starting to show signs of dementia or old age?
Well, and I think, I think I wasn't aware of the cognitive caps, but I definitely, even in my own health now, I do think, I mean, it's kind of to me, it's a combination between medicine and supplement. And I do think these supplements help. I mean, I do think in the earlier you start them, it's just like, you know, we, for a long time, I think as veterinarians recommend glucosamine and cosequin and stuff for joint health. And I think this is true for this situation too. I think the earlier you can start cognitive caps, I think it's going to be more beneficial. Now, where is that? I don't know, but I think it's obvious. You can start to see when you're starting to see confusion. You know, I think where they just are sitting at their food bowl and kind of going, what was I eating, or am I done? Or, you know, I mean, so I think there are those little triggers that you can see when they just start disassociating just a little bit more than normal, or they're acting a little more confused, or the pacing at night starts. I think I would definitely recommend starting the cognitive caps as a first line. I think I would do it as a first line course rather than waiting to do a lot of the medications, because I think it's just more beneficial and less harmful. I'm not worried about side effects and that kind of stuff. So I would as early as you could start them, I think, because I think might be the most beneficial thing you could do.
And we developed cognitive caps as a preventative. We didn't really expect that it would be a therapeutic when we reverse clinical signs. We really thought we'd prevent them, but I'm very happy that it's reversing. I do wish we'd get more people to start it earlier. And then I think they wouldn't have to experience, you know, going through dementia is really tough. I'm dealing with that with my old dog right now too. And he definitely responds to the cognitive caps, but it's not easy for any. Joe, what would you recommend? So one of the things that we talk about a lot is that it can be difficult for people to figure out, you know, is this normal aging, or is this truly dementia? Because we're probably not going to help normal aging, but dementia is a different story. What do you tell your clients on how they can differentiate the two?
And for me, it's kind of hard because I'm not in general practice anymore. So I'm not seeing them as, you know, I mean, I'm now at end of life. And so most of the ones that I see are pretty well established, I'd say. There are a few hospice cases. We do try to intervene a little bit. And I certainly, if I start to see more hospice cases again, I would definitely advocate for cognitive caps. And even my friends that are in general practice, I'm like, hey, you got to try these. If you think you got a dog with cognitive dysfunction, give these a try, because they really made a difference with my dog. So I think if I were in general practice, I would say you just got to, just like everything else, keep the little journal. I mean, just like you do for seizures, you know, so maybe keep the journal for a few weeks and like, is this something I'm seeing him do all the time? Is this a regular thing, or is this a really sporadic thing? It's just like a bad day, you know? because if you're starting to see the, the disassociation or the increased pacing or the staring and just lack of awareness, and it's continual, like on a daily basis or more days of the week than not, then I would definitely say try it, because it's not going to hurt and it can only help.
Right.
But if it's where you have to pay attention. Well, again, it's how in tune are you to your dogs? Not everybody is. Depends on what kind of a dog owner you are. If you're really in tune and your babies, then you'll know when it's time to do stuff like that. And otherwise, they're going to be just being their couch potatoes. So, but I do think
one thing I do tell people on occasion is that with normal aging, it tends to be a slowly progressive decline. Sometimes with dementia, it can almost seem like it's overnight.
Yeah.
And we know it's not really happening overnight, but something's triggered that makes them much worse, in a very short period of time. And if that happens, that's more likely to be dementia than just normal aging. So that's one thing people can look out for is, did this happen quickly? Did it progress very rapidly? Then it's probably dementia.
And I think, especially like with Laddie, I think his change was pretty sudden. I mean, he's an older dog, but then, like I said, when I was not in a good state of mind, I noticed a dramatic change in him too. So his changes were very acute, I'd say, but he's also recovered pretty quickly too. So, and he still does it once in a while, but not at all like he was in August of this year. So it was bad.
Well, we are so happy to hear that Cognitive Caps has helped yet another dog. And I mean, like I said, it's why we do what we do is for owners like you. And it's especially nice for me when I'm talking to a veterinarian. It is kind of able to help. So yeah, all veterinarians are my friends at this point. I feel so nice. Dr. Millard, it has been an absolute pleasure to talk to you. I'm so happy that Laddie is doing better. Did you have any last words you want to say to anybody out there?
You guys are awesome. And it's been a pleasure to meet you. I didn't really expect that to happen, but no, I'm grateful for the work that you guys have been doing and the help that you give our little babies. And like I said, I definitely am an advocate for Cognitive Caps moving forward, especially in my stage of work. It could prove to be very beneficial. So I just really appreciate the work you're doing. So thanks for being out there.
Thank you so much.